This is the case of double inlet single ventricle. Double inlet means the ventricle is getting from blood from right atrium and left atrium, that is inlet, and single ventricle means only single ventricle is, you can see in this case only single ventricle of left ventricle morphology, and right ventricle portion is very much hypoplastic, so does not appear in this image. This is left atrium, this is mitral valve, this is right atrium, this is tricuspid valve. Both are draining into one ventricle, that is of left ventricle morphology. So double inlet into single ventricle. In this image, what you see, you can see this is main pulmonary artery. You can see this valve is not opening properly, indicating valvular obstruction. So pulmonary valve obstruction, and aorta is coming from remaining hypoplastic right ventricular outlet portion. From this portion aorta is coming, and this is the main portion pulmonary artery is coming. So pulmonary valve obstruction and pulmonary valve is mainly coming from left ventricle, main ventricle, and only that hypoplastic right ventricular outlet portion, that outlet portion is only seen in this image, is giving rise to main aorta. So ultimately detransposition of great arteries. So this is the case of double inlet single ventricle with detransposition. You see this is the BSD. This portion is BSD. Again double inlet single ventricle. This is cross-sectional view. You can see the obstruction, valvular obstruction. Again you see this is pulmonary valve, flow obstruction. This is aorta, no flow obstruction. And this portion, right ventricular outlet portion, is only giving to the aorta. So aorta coming from the remaining right ventricular outlet portion, hypoplastic right ventricle, and main pulmonary artery is coming from, this is left, from the left main ventricle, left ventricle. So ultimately only one ventricle receiving all the blood and giving through BSD to aorta and directly to pulmonary artery. Though pulmonary valve obstruction is there, that is why this patient is old, almost 35 years old already, still surviving all this cardiac problem, only because there is flow limitation to the pulmonary artery. There is pulmonary valve obstruction, so less blood is going to the pulmonary artery circulation, so pulmonary pressure has not become that much high, pulmonary hypertension has not developed, and patient is still surviving. Patient is having some sort of symptoms in the 35 years of age, and patient has already 2 children with everything normal. So here the stenosis has become boon for the patient, become advantage for the patient. So this case is double inlet single ventricle with pulmonary valve obstruction. That obstruction is advantage for this patient. That is why patient has survived up to the age of 35 years, and patient is still doing well in spite of this much high congenital abnormality. So this case is double inlet single ventricle with detransposition with pulmonary stenosis, valvular stenosis. You can see the pulmonary valvular stenosis. This is the aorta. This is right ventricular outlet. Aorta is coming from right ventricular outlet, no flow obstruction. You can see this is pulmonary artery coming from the main ventricle. You can see this is aorta. Aorta is anterior and slightly right. This is pulmonary artery. Aortic valve, pulmonary valve. You can see very interesting case. Aortic valve, pulmonary valve. Again double inlet single ventricle, double inlet single ventricle, double inlet single ventricle. Quite good image, apical four-chamber view. Double inlet single ventricle. So this is the case, detransposition, double inlet single ventricle with pulmonary valvular stenosis. You can see the pulmonary valvular stenosis. This is pulmonary valvular stenosis. You see the pulmonary valve is not opening to the full extent. This pulmonary stenosis has become advantage for this patient. Pulmonary artery getting less blood supply, less flow, so no pulmonary artery hypertension, no pulmonary vascular changes, pulmonary vascular chronic changes. Pulmonary vascular resistance has not become that much high in spite of this much age, and patient has survived. That is, to this much is quite good thing. Thank you.